roll out this intervention to be able to enhance their testing capacities at county level. And this includes both laboratory testing, but also syndromic surveillance, to be able to have proper contact tracing mechanisms in place. County governments need to deploy rapid response teams. These teams need to be agile, and they need to be able to be supported to ensure that they can trace appropriately. And of course, treatment facilities need to be readied in terms of being able to receive any sick or severe patients, and ensuring that our isolation and home-based care program are efficiently run. In the meantime, we would like to continue urging each and every one of us to continue, again, seriously observing all the containment measures, and to remind people that really there is no alternative strategy. There is no other mechanism in place. As we've said time and time immemorial, it is up to us to be able to wash our hands, to maintain physical distance, and to be able to mask. Those really are the alternatives or the measures that we have in place right now. Another key element that we feel we must emphasize is that it becomes very important to have personal responsibility as each and every Kenyan, and therefore expecting law enforcement agencies to compel us to observe these measures can only help in creating an environment where the virus will thrive and get out of control. There are those of us who only wear the mask when in the vicinity of law enforcers, only to remove it immediately after. And there are those of us who actually also don't wear the mask correctly. And there are those of us who have very low regard to the social distance requirement. And it is important to note that this, again, is a recipe of disaster, and we really do have to take personal responsibility. Turning on to our COVID-19 situation, today we have tested 2,718 samples, out of which 259 people have tested positive for the virus. The cumulative number of tests conducted so far stands at 165,196,000, and the total caseload for the country right now is 6,070. So we've now surpassed the 6,000 mark. All the positive cases are Kenyans, except 3 foreigners, 159 being male, 100 being female. And in terms of age, the youngest is 8 months old, whereas the oldest is 92 years. The 259 cases are distributed as follows by county: Nairobi leading with 127 cases, Mombasa 39, Kiambu 22, Machakos 16, Busia 11, Makueni 9, Nakuru 9, Uasin Gishu 9, Kilifi 5, Kajiado 3, Kisumu 2, Lamu 2, Garissa 2, Marsabit 2, and Kwale 1. And in terms of sub-counties, again, I'll jump into the key high-load burden areas. In Nairobi, out of the 127, Westlands, again, is leading with 31 cases, Dagoretti North, 22, Makadara, 12, Embakasi East and Langata having 11 each. In Mombasa, the 39 cases are from Likoni. We have Likoni, having 13 cases, Mvita 8, Changamwe 7, Jomvu 6, Nyali 4. And in terms of Kiambu, the 22 cases, 8 from Thika, 6 from Kiambaa, 4 from Kiambu Town, Juja, Kabete, Lari, and Riru all having 1 case each. In Machakos, the 16 cases, we have 15 from Athi River and 1 case from Machakos Town. In Busia, out of the 11 cases, from Teso North, we have 9. In Makueni, the cases that we have, Kibwezi West has 7. And in Nakuru, out of the 9 cases, in Naivasha we have 4, in Nakuru East we have 3, Rongai 2, in Uasin Gishu we have 3 from Ainakeboi, Kapsaret and Tubo have 2 cases. And in Kilifi, the 5 cases in terms of disaggregation, Kaloleni and Kilifi South have 2 cases each, and Malindi has 1. And in Kajiado, the cases are in Kajiado North, where we have 2, Kajiado Central, we have 1. Lamu is the latest county to report a case, bringing the total number of counties in the country that have COVID-19 cases to 41. So we now have 1 additional county, that's Lamu. We are happy to report that we've discharged 35 patients from various hospitals, bringing the tally of recoveries to 1,971. Unfortunately, we have lost 2 more patients to the disease, bringing the total number of those who have succumbed to 143. And our thoughts and prayers are with the bereaved relatives and families during this difficult time.